Welcome back, dear viewers, after this short break, and welcome Dr. Fatimah Alansari to DocTalk.
Thank you for having me. Thank you.
Okay, now let's jump into business because it's a very sensitive subject. What is meant by cardiac rehabilitation?
Well, cardiac rehabilitation actually is a program. It's a multi-component program that includes exercise, diet counseling, medication compliance, weight management. It's multidisciplinary, so a lot of healthcare professionals look after a patient who had heart surgery or have heart disease.
So you talk about it's a combination between different stages of recovery. So what is the difference between the medical treatment and rehabilitation? Because you said it's different. Is it all connected to each other to give the effect that is goal to?
Yes, definitely. Well, actually, medical treatment is supervised and looked after by cardiologists, by doctors. And rehabilitation is actually focusing on the patients restoring their function. So medical treatment is basically anything that includes medications, medical procedures. But rehabilitation, we look at the patients as physical therapists and cardiac rehab specialists, looking into the patient's physical activity, looking into their exercises, looking into any other disabilities that they would have, along with managing their disease.
Okay, because we see a lot of cases in our daily life that even if he's healthy, he had a heart attack or cardiac problem, but loses some of his physical function.
Definitely,
okay.
Yes.
So rehabilitation is an essential part after heart attacks or surgeries, and some people neglect it. How do we raise their awareness and guide them back to rehabilitation?
Well, actually, because cardiac rehab has a lot of phases, it starts from the admission of the patient in the hospital or the ICU or the CCU. So we raise the awareness along, of course, with education and campaigns, but also starting from the hospital for those who never heard of cardiac rehab and had these cardiac events. So we start by educating them about what they will necessarily do in the near future. So it starts with at the hospital, and then we monitor them and follow up with them after they are discharged from the hospital. And then they continue with us as an outpatient program that we tailor and to the patient's needs. So we prescribe for them specific exercise prescriptions, according to their goals, whether it's personal goals or objective measurable goals.
Okay. Is it only exercises or it's a combination of something else?
Oh, it's a combination of many things. But for us as physical therapists, we focus on their physical activity and their exercises. And along with our fellow colleagues, such as the cardiologist, such as the nutritionist, psychologists, social workers, we all look into the patients, even sexual counseling. If patients have problems with any sort of problem that is affecting their daily lives, all of us as healthcare workers and specialized in cardiac rehab look into these patients' problems.
Okay. Does cardio rehabilitation prevent or reduce the possibilities of having future cardiac problems?
Oh, definitely. Studies have shown that it reduces mortality, it can prevent more relapse or recurrent other cardiac events. And it also helps gaining fitness, physical fitness, and also promoting physical activities. So we help the patients, support them emotionally, enhance their mood. So even socially, on a social level, we try to help the patients, those who are isolated or having some sort of, or having neglect from, whether with family problems or their nutrition. We can definitely help these patients.
Okay, you talk about the social, let's say the surrounding community or socially, but how it's important that psychologically and social support is important in this stage, especially in rehabilitation. We know that there is social pressure and there is peers pressure, all kinds of pressure.
Yes.
Okay, and there is, let's say, anxiety and there is fear. How can psychology help to overcome these steps?
Well, psychology helps a lot. Now, first of all, peer pressure, that's a really interesting point that you brought, because a lot of my patients who are young usually are in denial of having a problem with their heart.
Yeah.
So even when they start the cardiac rehabilitation program, they would think that, oh, there's nothing wrong with me, and they would really want to step up the program in a very high speed level. And so we need to look into that and make them acknowledge the problem that they do have. And then also you have patients who are depressed, who do have anxiety from physical activity and scared, and don't want to be mixing with the society and staying usually at home. So we do help these patients also gain their confidence back, maximize their independence. We try to help them. If they do have more problems, then we would definitely get a psychologist involved, and we can help together, because, as I always say, they work both ways: physical activity and mental health. And so if the patients are having mental problems, that will prevent them from being physically active, and vice versa. If they are not physically active, it will not improve their mental health.
So, but my question is it the fear that going back to the same events or incident, some people are in denial that they have cardiac problems or heart problems? Is it that the fear
of course,
of losing that life pace, being normal again?
Oh, it could definitely, especially if they're neglecting their health in terms of diet and in terms of their exercise, and also self-monitoring or self-perception. If they are not in touch with their doctors, a lot of patients, they would take their medication and don't see the doctor for a year, for instance.
Yes.
But they need to follow up. They need to, I would always say, not listen to your body. I would always say, try to feel your body and feel your symptoms. And also try to engage your family members, because social support is very important, whether it's with your spouse or with your children or friends. And keep the light exercise going. Always keep it light, keep it supervised with the specialist, as long as you continue, because we need to exercise throughout our lives forever.
Yes, exactly. Well, Dr. Fatimah, we need to take a break to look into the upcoming report, and then we're going to keep talking about cardio rehabilitation and its importance. So please stay tuned after this short report. Welcome back, dear viewers, after this short report, and we have with us Dr. Fatimah Alansari. We talked about cardiac rehabilitation. Now let's talk about what is the first exercise, or what is the first step. Okay, you had your patient, now they are recovering and everything. Whose decision or whose call to move the patient to you as a specialist?
Well, as I mentioned earlier, cardiac rehab starts from phase 1 at the hospital. So after having any problem, any cardiac event, such as cardiac disease or surgeries. So the patient is referred by the cardiologist to the physical therapy department. So we assess the patient, we look into their problems. Now it varies from patient to patient, of course, but usually we look in their mobilization. So we need to make them, we start with very light exercises. It could be bed exercises, it could be out of bed exercises, walking around in the room, chair exercises. And then slowly we can take the patient out in the ward and in the corridors and walk. And then after the patient is discharged, we follow up while they're at home, while they are waiting for their appointment as an outpatient cardiac rehab patient. And then when they come to the medical gym at the hospital, we set a program. As I mentioned earlier, it's tailorized and individualized for the patient.
Each case is different.
Each case is different, exactly, because you have young patients, you have older patients, and you have patients who are like the elderly. So each patient, and then you have to look into women and men. So different
patients,
all
and different cases,
patients,
and
definitely. And we look into their goals. I always encourage patients to look into their goals, whether they have personal goals or they have, as I mentioned earlier. So this is how we start, very light, and then we build up gradually. Now the build up, even when it's in the phase 3 as an outpatient clinic, the patient doesn't necessarily have to reach high levels of physical fitness. The patient can maintain. I would be happy if the patient maintains their physical activity and their exercises and not worry about
their physique or their shape.
Exactly, because by time you will lose weight, by time your diabetes will be in control, your cholesterol will decrease.
So feel good before you look good.
Exactly. So we need to look into the medical problems that the patients have, even if they don't necessarily have these problems. But I would be happy if the patient is physically active and doing some sort of exercises every single day and throughout the day. I would be happy with that and maintain that level, and they will be they will see the improvement day by day.
Okay, what is the type of exercises for daily use? Yeah, for if it's walking, it's jogging, or let's say aerobics. Is there certain kind of exercise that, let's say, I can do it at home as a healthy also patient?
Definitely, there's lots of exercises you can do at home, starting from the time you wake up. So you can do, of course, the walking. You can do light aerobics. A lot of people have swimming pools, so I encourage them to swim in their swimming pool. And that doesn't necessarily mean Olympics,
yes.
you know.
Just
walking,
feel
some
the water.
aqua,
Yes.
exactly, some aqua exercises, just to get out of the sofa, get out of the bed, get out there and get on your feet and move. And then mix it up with also sports. You can also play sports, you can go back to sports, but it doesn't have to be competitive if the patient is not a professional sports athlete. So it all, again, goes back to the patient's goals.
Okay. What is the role of medical devices in maintaining during activity?
Okay. So basically, cardiac monitoring is looked by the cardiologists. They would use the Holter monitor to look into patients 24 hours, 48 hours, or 72 hours.
They call it the reader.
The reader, yes. Yeah. And so it's basically, it's an ECG to look into patients' cardiac activity, or the heart electrical patterns, the arrhythmias, any problems that the heart would have, any other time throughout their day, whether they're sleeping, whether they're jogging, walking, any physical activity.
Or going to work, they need to monitor the heart activity.
Exactly. And then you have also, with us as physical therapists, we have the cardiac telemetry. Now, the cardiac telemetry is basically also a Wi-Fi ECG that is also attached to the patient with electrodes, and we look into the patient while they're exercising. So that is specifically made to look into patients while they're exercising. So you have different kinds of cardiac monitoring.
So Dr. Fatimah, we talked about medical devices. Now let's talk about timing. What is the best time to do these cardiac exercises?
The best time to do cardiac exercises is actually any time of the day. But with cardiac rehab as an outpatient program, of course, it depends. We set appointments with the patients, but we do give them a program, home-based program of exercises that they should do. And they're very light, they're very gentle for them to do. They can choose whenever they want to do, but as I always advise patients, that they should do them throughout the day. And even house chores. even include house chores,
light house chores.
Light house chores. Of course, a lot of my patients, they sometimes they confuse light house chores or house chores with physical activity, which I know it's very stressful for the patient. So I would tell them, enjoy your house chores. You should not be doing the house chores and you're stressing yourself. And you will definitely not get the benefit, and that's why maybe they will
will get things worse even.
Exactly, it would get them worse, and then they stress, and it gets overwhelming, and then they want to put everything aside again, and that they don't do anything. They get into the depression cycle.
Yeah, they're fed up because of the excessive exercise.
So I always tell them to enjoy their house chores and physical activity. Use the stairs, park far a little bit, have a walk, put on any exercises on the TV. There's a lot now on the social media platforms that you can, follow.
And instead of going to the gym.
Exactly. And I provide them with a lot of videos also, which I know that they are very light. So I would tell them, no, follow this video. And even these videos, I tell the patients, you don't have to do the whole complete video. And you don't have to do the same pace as the specialist or the personal trainer that is doing. So it could be any time of the day.
Well, that ends our segment for now. And next we're going to jump to myth and fact. You're going to enjoy it, Dr. Fatimah. So please stay tuned after this short break. Welcome back, dear viewers, after this short break. And now we are in my favorite segment, myth or fact, with Dr. Fatimah Alansari. So my first myth is, if the patient takes medicine regularly, rehabilitation is not important.
Oh, that is completely false. Rehabilitation is as important as taking medicine, and taking your medicine is as important as rehabilitation. And even if I'm a physical therapist or cardiac rehabilitation specialist, I do not encourage patients to neglect and not take their medication. I strongly advise for them to be compliant with their medication and also do their exercises and come to the cardiac rehabilitation program.
I need to have a long talk with my uncle. So my next myth is, climbing stairs is always dangerous for the heart patient.
No, it is not. It's not dangerous for heart patients. Actually, on the contrary, you can build up. I always also advise patients and tell them, use the stairs at home as a gym equipment. And also start slow. And a big advice that I would always encourage my patients is, when you climb the stairs, never rush and never climb when you need to go upstairs. Use another different time to use it as I said, as an exercise. So you go up gently and then you come down, and then depending on the patient, but you can definitely use it. And of course, after we assure the patient's safety, and we know that this patient is stable enough to use the stairs. But in general, it is not dangerous.
Okay, now this myth is kind of important. I need to verify. Heart patients cannot exercise at all.
Oh, also completely false. Heart patients can definitely exercise. Years ago, let's say 50 years ago, they would always advise with rest, and they used to look into only patients with heart attacks.
Let them rest, let them be calm. Do not excite them or give them any bad news, because they may react.
Definitely, yes. But it has evolved, and the program has expanded tremendously. And so now you would include all sorts of cardiac patients, as long as the doctor thinks or decides that the patient is safe. And also you look into patients who are at high risk of developing, so before they even have cardiac arrest. Let's say patients with a family history, or patients who are obese or have high cholesterol or diabetic. A lot of patients who are diabetic should be careful, because the studies have shown now diabetes is linked to cardiac diseases. So patients who are not physically active, patients who need that guidance with a cardiac rehab specialist. And they don't have to come and join the whole program, the whole course. They can come for advice, for counseling, for guidance, and surely will definitely guide these patients and help them.
Dr. Fatimah, let's say that there are patients who get paralyzed after heart attack or heart surgery.
Yes.
How severe and important is the rehabilitation here?
Definitely very, very important, because patients who do get paralyzed, especially after cardiac surgeries,
Yes.
a lot of patients, they would probably have a stroke or they would have complications during the surgery. So they would definitely need a full rehabilitation program, a very intensive, very comprehensive, and probably they would need a cardiac rehab specialist, neurology, physical therapist specialist.
So they need the whole team.
They need the whole team, and definitely a psychologist, and with their doctors follow up, and their nutrition, of course, especially if patients are carrying a lot of weight. So imagine you're carrying that weight and then you end up having a stroke. So you would think you're being admitted to a heart procedure, and then you wake up, you cannot move.
Yes.
And you're carrying that weight. So also they need to look into their nutrition. So it's a very, very large programmatic
it's not
rehab.
a cookbook. It's not a cookbook or it's a text.
Definitely,
it's a tailored to each case.
Exactly, and detailed assessment for the patient.
Okay, you talked about nutrition. That leads me to my next myth. Diet is important, more important than exercise.
No.
Okay.
They are equally important.
Okay. Yeah, so
yes.
You cannot, let's say, eat
مجبوس
lahem and go to bed. And
no, you cannot separate. You can eat in moderation. You can eat whatever you want, but you need to cut down the portions. You can eat whatever you want, but if you have specific problems with your nutrition or with some things that come up with your blood test, you need to definitely look into a nutritionist for nutritional counseling.
Is there a certain kind of food that during rehabilitation that the patient need to avoid, or it's, as you said, moderation is the key?
Well, in moderation, but it depends on the patient. If there are some things that are definitely not advised for the patient to have, after finding out with their doctors or the nutritionist, definitely they would have to stay away. But most diets, which I don't like to promote any certain diet for a patient, but definitely eat in moderation, cut down your portions. Again, self-monitor. You can do our diary. A lot of patients, I would encourage them to write a diary.
A diet diary. That's
a diet
amazing.
diary.
Yes.
Even with other vital signs like your blood pressure, your heart rate, how many times.
Just like to build your own medical history.
Definitely, definitely. Sometimes some patients, I would get two types of patients like this in Kuwait. Some patients love that idea, and some patients, they would look into it. Oh no, I'm not going to write.
That's too much.
It's too much. But as much as I can, I advise to do that. So just to keep up, and then when you go back and you look into what you were eating, how much you were walking, what other problems you had, it would be very nice, especially if you are forgetful with these things. And then it will be very helpful for your healthcare professional, whether it's a doctor, whether it's a nutritionist, whether it's a physical therapist. When you go, you're prepared with your questions, and they could definitely modify your treatment plan, modify the exercises, modify the medication, especially the doctors. So I encourage all these things, for the patients to do.
Well, that's amazing, especially the diet diary. It's a very nice idea.
It is, yes.
Well, Dr. Fatimah, that concludes our Myth and Fact segment. We're gonna jump into our final segment for today. So please stay tuned. Welcome back, dear viewers, to our final segment for today with Dr. Fatimah Alansari. So now we're going to talk about family and, let's say, the surrounding environment or the community, the supporting elements for the patients. So what is the role of family in encouraging the patient to follow up with the program? Some people say, yeah, khalas, you don't need it. You're better now. But let's say that, let's push the family to be more considerate in this program.
I always encourage family to be supportive, to engage, to be involved with the patient's rehab journey, starting from the hospital. Because the patient does feel weak, the patient does feel fragile, and a lot of the patients that are in shock, especially those who are physically active or athletic, they would definitely need that support.
They feel like it's a setback, their life is ended.
Definitely, because they start to withdraw from physical activity. So the patient family need to encourage. So it's very highly important for them to encourage them and take it slowly with them. Let them take their time and do it bit by bit every day, especially with the kids. I encourage the patients sometimes, if they have grandkids or their own children,
to get involved
because
with them.
children are usually, they're very active.
Yes.
They're cheery, they're innocent. So they feel positive when they're surrounded by children. So make it a little bit playful, but be also safe. And then especially those who are very depressed, but definitely then build up and then start, especially when they're discharged, start to have a program at home and encourage, with the supervision of the cardiac rehab specialists and the doctors, to try to battle these fears and anxieties.
So it's not only the patient, let's say it's the whole house is the patient.
Definitely
now.
Everybody in the family, and it'll be very helpful for the rest of the family, especially if they're not physically active or they don't exercise. So this could be a fresh start for them. So have a lot of sorts of activities, and especially if it's a family that loves to travel a lot, they should always prepare themselves. I love to advise my patients before you travel, because here in Kuwait, I'm sure you've heard of this, they don't do anything, and then once they travel, and then they suddenly have knee problems or back problems, or
our daily life is like it's routine. It's not a daily life.
Exactly.
We don't have that trails, or we don't have that parks that requires moving and walking.
Yes, definitely. And then they feel that their physical fitness, they're having problems with their breathing, or their heart rate. So I always encourage them, before you travel, you have to prepare. The whole family has to always remind each other that they need to be physically active and look after their nutrition and monitor their weight if they have weight problems, and monitor all other, especially if it's a family history of cardiac diseases in the families.
You said that you have teenagers also in the cardio rehabilitation. Do you think that we need to impose cardiac rehabilitation in schools as a kind of fitness?
Oh, definitely. It's very important to teach children, teach teenagers from a very young age about healthy lifestyle habits, about the complications of heart disease, about family history, about how to save a family member from having a heart attack, and how to deal, CPR courses,
first aid courses, all these. This is very, very important to educate, starting very young, because it will help the society. It will help everybody self-monitor and also pick up on problems. And also it helps also, especially with family members, it raises their awareness and raises their care for each other, for one another. Well, Dr. Fatimah, it is lovely to have you. And it was an amazing subject to address.
Thank you so much. It was lovely to be here. I'm honored.
It's our honor, and it's our pleasure to have you.
Thank you so much. I was so happy to be here.
Well, it's our pleasure.
Thank you.
Well, my dear viewers, also thank you for joining us, and enjoy your day.